morning, fundamental surgery. You're through to Gurgen. How may I help you?
Okay, so bring him in today at 3, all right?
I literally feel like I've been hit by a bus some days.
Have you been eating?
Yeah, I had a big fat kebab and everything, so I was all right.
I go to the toilet a few times a day. And when I gotta go, I literally have to go.
What, it's stand back, I'm coming through?
Yeah, like if anyone's in there, they gotta get out.
The only solution to this is an operation. The operation itself is painful, and it's very painful afterwards.
I've got a 33-year-old lady who's been diagnosed with gestational diabetes. Most of her readings are high.
Are you using any contraception at the moment?
I'm a lesbian, so...
OK.
Yeah.
All right, so you don't need any contraception cover?
No.
Can I just tell you a good joke?
All right, go on then.
So there's a nightclub and there's a fight in this nightclub, and this blonde comes out covered in blood.
Hello, fundamental surgery. Nikki speaking. How can I help?
Mr. Bunting? Hi. Sir, come in.
About 2 weeks ago, I got a little black lump underneath my tongue.
Right.
I just want to find out what it is.
And it's stayed the same since you first noticed it?
It's got a little tiny bit bigger, but it's not massive. It's just...
OK, I'll have a look. It's just the light.
Oh, right.
OK? Take it open your mouth. Right. And it's not causing you any pain? And...
I'm a bit worried because I had a tumour took out there.
OK.
So how can I help today?
It hurts. I had labour and it's worse than that.
OK, worse than labour?
Yes.
That must be the worst thing imaginable then. I can't imagine anything worse than labour.
It hurts. My stand up is easier. It starts from there,
Yeah.
goes round, down there, and to there.
OK. And that's been since...
Tuesday.
Did it come on gradually on Tuesday, or did you suddenly...
No, I just woke up.
You woke up with it on Tuesday, and it was like that? You hadn't done anything on Monday that might have caused it?
Nothing, no.
You weren't out digging the road, or...?
No, I was behaving and I wasn't swinging from any trees and stuff.
Right, not...
No.
OK, yeah.
Took 2, naproxen, and I took 4 paracetamol.
Took the edge off it, didn't touch it?
Nothing, no.
Nothing? And pooing and wings OK?
It's fine, yeah.
OK. Right, let's have a look at your leg then. Well, wait, back first of all. Just stand up for me. I can sit down. That's OK?
Yeah.
OK, can I lift this up?
Yeah.
OK, so whereabouts does it hurt?
There.
There. OK. Does that hurt?
Yes.
How about yes then? Does that hurt there?
No.
But that hurts that side there?
Yeah.
So all the way across there?
Yeah.
And then down here, does that hurt?
No.
OK, so can you touch your toes? How quick can you get? My glasses.
There.
OK, how far back up can you come? How far back?
Oh, no.
No?
No.
Can we lie you on the couch? I just want to lift your leg in there. Is that OK?
You've got a step in.
Got a step? I'll give you a boost if you want.
OK, one moment. Bear with me.
And you did mention that in the past you'd had to have something removed.
They called it a warfarin tumour. W-A-R-F-I-N. Warfarin.
Wartin's tumour, there we go.
Oh, it's got a T in it, has it?
OK, so I'm just going to go in and just sort of feel this area that you mentioned. When I squeeze it, it almost seems to disappear in terms of the colour, and then it returns. It almost feels like a blood vessel in the area.
That's what the wife said.
Did she?
Yeah.
OK.
And I thought it was going to disappear on its own, but it hasn't. And I'm just a bit worried as to what it is. But...
OK. I mean, even the thing you had before was a benign sort of thing, and it wasn't sort of a cancerous thing which could potentially spread. So I don't think there's any association between this and what happened before in 2005. Can I just check the glands in your neck just to see if there's any enlargement? It's fine. And you've been well otherwise?
Yeah.
Any weight loss at all?
This is it, yeah. I've lost quite a bit of weight. The wife says it's down to eating better, but I don't know. I mean, I haven't lost an appetite.
Has she changed your diet?
And she's retired now, so It's a lot more healthy food.
Can I check your weight? You can leave your shoes on if you want. It won't make it.
I would do, but they're still toe cap. I think
Sometimes.
I think I've gone down to about 15 stone or so.
It's actually the same.
The same?
That's what it was in January.
Oh, it must be the scales at home then.
Going back to your this thing under your tongue, personally, I would say I don't think it needs removal at this stage. For my estimate of looking at it, it measures about 2 millimeters in diameter. If it doubled its size, I would want this to be looked at a bit further. But I think we can watch and wait for now.
Nothing to worry about then.
No. Okay?
Yeah, that's fine.
All right.
Okay.
Take care. Bye-bye.
Thanks very much. Then.
See you.
Bye.
Is that hurting?
Yeah.
When I do that, where does it hurt? In the back. How does that make you feel when I do that?
Oh, yeah.
Makes it worse, yeah?
Yeah.
How to bend your... There. Is that okay?
Yeah.
Okay. Just sit you up. Okay, just swing your legs around. Just come have a seat.
Oh, what have I done?
Okay, right, so this feels like the muscle in the back. It's a very common thing. It's the commonest cause of backache probably is the muscles. And being as we are upright on 2 legs, and so 50% of us will get backache at some point, and often we don't know what's caused it.
No.
Yeah. As uncomfortable as those chairs are, you need to sit in an upright chair, not in a lounge chair, because it curves your back. The treatment is not to lie down and rest. The treatment is to keep mobile, but not to bend and not to lift. The warning signs of backache are numbness on the bit of your bottom where you sit on the bicycle saddle, or if you can't wee, or if you're incontinent to poo. That's that's what we call a red flag. That's straight to hospital. Don't pass go. Don't collect any money. Just go to hospital. So, shall I give you some codamol, which is codeine plus paracetamol?
I'll take anything.
Will you?
To get rid of the pain, yeah.
Okay, so you can take naproxen with these, okay, but you can't take paracetamol with them. Keep moving, and if it's not better in a week, you'll probably be seeing you again. But if you've got those red flags...
I will do. I will do.
Nice to see you. Take care. And you. All the best. Bye-bye, Sue. Bye-bye.
Hello. Bye-bye.
Hello. How are you?
Hello.
Hi.
How are you?
You did it again. You did the weird hello.
Oh my God. They keep moaning about my hello. Is it that bad? Did you like my hello? Hello.
Hello.
Who comes out? Hello. That's not my fault, is it?
Are you okay?
How are you?
Yeah, that's sure bad. Okay.
Good.
It's all right.
Well done for coming to see me.
Okay. Blood test or?
Yes, completely. I was going to call you, but then I realised you had an appointment with me, and I thought I'd wait and see to see if you attended. So this is your cholesterol level. It's 5.7. Okay.
Is that low or?
That's high.
Is that high?
But this particular type of fat, it's called your triglycerides, is really high.
Mm-hmm.
The normal range is 0.45 to 1.82, and yours is 7.6.
7.6.
But 2 years ago when we spoke to you, it was 14.
14 was
So it has come down, but it's still really high.
Yeah. Sometimes, I've been to the parties, things and drink and eat too much, muttons or fat food.
Okay, with this particular type of fat, called your triglycerides, if it's really high, you're at risk of causing inflammation to your pancreas, which is the organ which secretes insulin, which controls your blood sugar levels. So we do worry about it, okay? How would you feel about starting some medication? Because this is all a risk factor for heart disease, putting you at increased risk of developing a heart attack or a stroke.
Oh, it's a lovely blue.
I looked out the window and I thought, maybe not black today. Come and sit down.
You're looking very lovely.
Love your hairband. Very pretty.
Cereal.
Where are all these badges from? You should collect them.
There's about 60 on it already.
I love your T-shirt, by the way. I wish I could wear T-shirts like that. Yeah.
I love your blouse. It's lovely.
It's lovely, isn't it? £4 eBay.
Really?
I just thought 32, 34, that'll do me. As long as it covers my big swollen arms, I'm happy.
You need to understand that this is putting you at completely high risk, and we need to try and control it and bring it down. So yes, your diet is really important. You need to cut out the fatty foods. You need to cut out the fried foods. Try and do some more exercise.
Yeah.
Do you smoke? Remind me.
No, I'm cut down now sometime. smoke 1 or 2 a day.
Okay, and how much alcohol are you drinking?
It's nearly quarter bottle like that, quarter cup bottles, whiskey like that.
Sorry, a quarter bottle?
Yeah.
Okay. For you, because your levels are so high,
Mm-hmm.
I think you need the help of medication as
Okay.
well. Are you willing to give it a go?
Yeah.
Yeah?
Oh, yeah.
Okay. I want to start you on a low dose to make sure you see your body
Okay.
gets used to them. Okay, and then we'll do a blood test in, say...
6 months? Oh.
Yeah, in 6 months' time. Okay,
Okay.
to see how you're getting on with them.
Okay. Thank you, yeah? Take care.
Bye-bye.
Bye.
Right, I've just seen Dr. Bolger, and she had agreed to give me a prescription. She forgot to give it to me, and I forgot to ask for it.
Might be in her room. Okay, I'll go
Okay,
and get
thank
it.
you.
I'll go and get it for you. Hiya, Mr. Harris. Just gonna take his prescription.
Forgotten his prescription.
Thank
yeah.
you.
Thank you.
Mr. Harris. Where's he gone? Where's he gone now? I'll see you. I've lost a patient. Where's he gone? Lost a patient. Mr. Harris. Thought I lost you. What's the address, please?
Thanks for coming in. Is it because we've been pestering you to come and see us?
Yeah. Basically, you said I had to come and see you before
Yeah.
you could issue me a sick note.
Yeah, because I want to see you, catch up with you and see how you are. Yeah.
Well, I'm not too bad, to be honest. I'm still like a little bit depressed and I'm not getting no help from nowhere. And like my Crohn's disease is still the same, but I ain't getting no help because I can't take tablets. So it's not getting no better for me.
Okay, so talk me through not being able to take tablets.
I went in hospital, I had pneumonia, like I never took tablets before that, and they tried crushing them up, everything, and I just kept throwing them back out, just won't go down. Like, it's just the thought of it.
It's a psychological thing.
Yeah, I don't know why as soon as it goes in my mouth, I just throw it back out. Like, I got so bad they had to like operate on me to get the fluid out of me. I had to use like a drill to drain to like my lung and take the fluid out that way.
So this is having a big effect on you then? You're not getting better because of it?
Yeah, no.
So tell me how your Crohn's disease is, as you're not having any medication.
Well, that's quite bad, to be honest with you. I go to the toilet like a few times a day. And when I got to go, I literally have to go.
What, it's stand back, I'm coming through?
Yeah, like if anyone's in there, they got to get out.
Okay. And is it loose?
It's never been like so. There's always been like water.
Okay.
And it stinks.
Yeah, okay. And any tummy pain or?
No, not really.
And how's your weight?
Before I had the operation, I used to be like 16 stone, I used to be pretty big, and I went down to like a stick.
And can you tell me about your diet? I mean, do you have to watch what you eat, or can you?
No, I don't. I can't eat dairy products or anything like
Okay.
that. I've been told that much, but I ain't been told nothing further than that.
Have you seen a dietitian?
No.
Right. Okay. Would you like to?
Yeah, I would. Yeah.
Okay. And then you said about your mood.
Been an ongoing problem, and like I don't have any motivation to do anything. Even like when it comes to having a conversation with someone, like I find it hard sometimes. I don't know what to say in that.
Okay.
I just gone really low, like low esteem, I suppose.
Do you feel bad about yourself?
I do sometimes. Like I get like bad thoughts about myself, but
Okay.
not all the time.
Okay. What are these bad thoughts about yourself?
I don't know. I just like feel like not wanted and stuff like that.
Like not wanted.
Yeah, like things like that.
Lily Ellis. Hi, morning.
Hiya.
Okay.
Okay. I'm going to Greece on Tuesday.
Okay.
And I'm due on my period that day.
Okay.
And I just wondered if there's any tablets you could give me just like the pill, just while I'm away.
Okay.
Because I don't really want to be in Greece.
Where are you going?
Crete.
Nice. How long are you away for?
2 weeks.
Okay. So when was your last period?
The end of last month. So I'm due on.
So you're due on any time?
Yeah.
And can I ask, are you using any contraception at the moment?
I'm a lesbian, so.
Okay.
Yeah.
All right, so you don't need any contraception
No.
cover?
No.
Excellent. All right. So in that case, and because it's such short notice,
Yeah.
there is something that we can give you.
Okay.
You're going on Tuesday, did you
Yeah.
say? Okay, so I would probably start taking it on Saturday.
Okay.
Okay, just so
Yeah.
that you take it 3 days before you're due to
right,
start
yeah.
on. And then take it for the time that you're out there, and then you need to stop as soon as you come back, because we don't normally give it for more than 2 weeks.
Yeah, that's
okay,
fine,
that'll be
yeah.
slightly there. For now, this will be okay, and you
Yeah.
don't need to worry about contraception,
No.
so that's okay. I prescribed norethistrone for Lily, sometimes known as the period delay tablet. Norethistrone is a synthetic form of the female hormone progesterone, which is responsible for maintaining the lining of the womb and prevents it from being shed. So this medication can help women that want to delay their period for some time. It can also help women who suffer with heavy, painful periods. It can have some side effects, such as bloating, nausea, breast tenderness, and it can also have an effect on women's cycle after they stop using it. The tablet is not known to have an effect on ovulation or the fertility of a woman. So when you come back and you start your period, things may be a bit abnormal for a couple of months. That's just the effects of the hormones and the pills.
Fine,
okay, so don't be alarmed.
Okay, that's fine.
So start taking this from tomorrow.
Okay.
1 tablet 3 times a day. Okay.
All
Have a
right.
great time.
Thank
All right,
you.
See you then. Bye-bye.
Do you feel like hurting yourself?
I did once, like on my arm there,
Uh-huh.
but that was about 4 or 5 months ago.
Okay. So nothing recent. And any thoughts about committing suicide?
No.
Okay. Do you drink alcohol?
Sometimes,
Okay.
but not all the time.
So how often do you go out for a drink?
Well, I've been out for about 2 months.
Okay. Do you smoke?
Cigarettes, yeah.
How many?
About 10 a day, 11. I'd love to stop because it's so expensive, and
Yeah.
but I just every time I try, I get 2-3 hours into it, then I have to start smoking again.
What? Okay. Would you like some help with that?
Yeah, I would.
Okay. So I arrange you to see our smoking cessation clinic here.
Yeah, that'd be good.
Okay. And do you use any illicit drugs, cannabis or anything
No.
else? No.
No.
Okay. Right.
I couldn't afford it.
Okay. On the scales. No. Okay, that's 75.
How much is 75?
That is about 11 3/4.
For a day, a lot, is it?
So I'm much, as a doctor, for your height, happier with you being 11.5 stone than 16 stone.
Yeah.
And then I wonder about getting you to go and see talking therapies to look at your depression.
Yeah, they were going to send me to that.
But also to see if we can help with this not being able to take medication issue.
Yeah, that's a big issue.
Okay, so that's 3 things. No, 4 things. Dietitian, smoking,
Yeah.
talking therapies, and gastroenterology. Okay, Michael?
Yeah.
You can read my scribble. Okay, thanks for coming in. Okay, take care. Bye-bye.
I've got sausages, I've got sausages. And then she went,
baked beans. I want to sing now. Because you maybe want to sing, but I don't want to sing.
What sing? What sing? What song? What sing we singing?
Wheels on the bus go round and round, round and round, round and round.
Now, it's time for the appointment.
Come on in, Maria.
Thank you.
Through. So, I saw you last week, didn't I? Week before?
Just over, yeah, week before.
Doesn't time fly when you're having fun?
It certainly does.
And we did loads of bloods, didn't we?
We did.
Because you're struggling with your back and I'm struggling with your back, yeah?
I'm struggling with everything. It's not even just my back. My toes hurt, my arms hurt, my shoulders, my collarbone, you name it, and it hurts.
It hurts.
Maria has been having problems with her back since the late 90s. She's seen physiotherapists, she's seen pain clinics, and she's seen orthopaedic surgeons. She's had repeated scans which have shown some disc damage and more recently some wear and tear of the facet joints. In 2013, the surgeons tried a decompression, which is where they took the disc out and they fused the vertebrae. But unfortunately for Maria, it hasn't really worked.
I did some bloods to look at how your immune system was working, and one of them was just a little abnormal. Nothing. The lab are basically saying we don't know if that's anything to be concerned about or not.
Yeah.
And it should be repeated in 3 months. There's certainly nothing that's jumping out of those bloods, but we can't leave you like this, can we?
No.
Maria has been diagnosed with fibromyalgia. Fibromyalgia is a collection of symptoms. It's a syndrome. To diagnose it, it really needs to have been going on for at least 3 months. Patients report widespread pain, tiredness. They also have problems sleeping, and they describe memory problems, so difficulty in thinking clearly.
It's moved from just your back,
Yeah,
which is where we just
I
to send you
literally
to.
feel like I've been hit by a bus some days. I can't sleep. The pain is waking me up. I'm miserable.
There are two options, I think. The first is to get you off to see a rheumatologist to explain that things have changed and for them to check that they don't think there's anything that we're missing that we should be treating. I may well have to go back to the pain clinic because I'm struggling to think what else we can
Whatever
use.
you recommend, I'm happy to go with.
It's very frustrating, very difficult when you see a patient whom you've worked through all the usual treatments that you would offer for their pain and you're really not making any impact on it. It's very distressing for the patient and very disappointing for the doctor.
Everything hurts. Fed up with moaning. My lot I must be driving them insane.
Hi, how are you?
Okay, I don't know if you had the A&E report. She fell back onto the floor while she was playing with her dad off the sofa. I can't even remember how long she was actually not breathing for. She went blue, rigid, and fell. And then a couple of weeks later, she did it again.
Okay, so what?
But it wasn't as bad.
What happens?
You know when you're crying but you don't take a breath?
Yeah.
She just didn't breathe. She went blue.
How long does that last for?
It felt like it was forever, but I think it was probably 5 minutes, the whole process. When she did come around again, she was slurring, she was still woozy. But once she made it to A&E, within like half an hour of being in A&E, she was back to normal again.
Right. And that was that one episode?
That was that one episode. Then it happened a couple of weeks after. She went from her room to her brother's room, slipped on the floor, and her brother went off on me. And I was like, what's wrong? What happened? Safa's not breathing.
Wait, did you see that long breath pause or anything? Or was it
No,
just
but her brother saw it.
Okay.
I know he's only 4, but he's quite aware because he was there when it happened the first time.
Okay. Did she actually go blue the first time?
She went blue, lips, face, everything was just blue. It was horrible.
I want to hand in these.
What is it?
This is really.
Sorry. I'm excited. I have it today.
Is it open?
That's okay.
Yeah.
That's all right.
I've got some special things for you. Because you're living.
Oh,
yeah.
yeah.
That is not
Oh,
naughty.
thank you.
So what you're taking at the moment?
Gabapentin. Can you actually do my prescription for me while I...
So you're on
Gabapentin.
duloxetine, gabapentin, amitriptyline.
I'm not taking the duloxetine.
You didn't like that, did you?
It gave me really bad nightmares and made me sweat like a workman.
Okay.
It wasn't pleasant.
So let's get rid of that.
I tried. I couldn't persevere
No,
with that one.
no, that's fine. Have you been on patches?
No.
That's another option, isn't it?
I'll try anything at this point.
When did you do the talking therapies, pain management stuff? Was that recently?
No, it was quite a while ago.
Right, but you're happy with it? You know what you're doing
Yeah,
with it?
I'd
They
sort
give
of-
you sort of exercises.
Yeah,
and things,
you
don't they?
get exercises. To be honest with you, I think the I can't remember, is it psychologist?
Psychologist, yeah.
I don't think she liked me very much.
Why?
Because she kept talking about think positively through your pain. And I was like, I completely understand what you're saying, but with all due respect,
When it's
if
bad, it's
I've got
bad.
a physical problem causing the pain, all the positive thinking in the world isn't going to take that away. And because she couldn't argue, I don't think she liked me very much.
Sure she did, but yeah, I mean...
But no, I get all of that.
The results were good. Prescription's gone. We'll wait and see what the rheumatologists think.
Okie dokie. Yeah, great. Thank you very much.
No problem.
Have a good day, and you.
Bye-bye.
Bye-bye.
How are you feeling, sweetheart?
I'm all right.
You weren't looking good at all.
I ended up with shingles.
Oh, God, that's so terrible.
Yeah.
Poor kid.
That was like 4 weeks ago.
Oh, no. That's the worst. That's a
How
love.
you getting on?
And Rosie said to teach my car just packed up today.
All right, sweetheart. No problem, darling.
No, it sounds like this could have been what we call a breath-holding attack, okay? So sometimes what happens is kiddies can hold their breath, go blue,
and it can be very, very dramatic and obviously quite distressing for the parents. There are two types of breath-holding attacks, and they're divided into blue or white. Blue breath-holding attacks are far more common and essentially occur when the child is in pain or frustrated or angry. The lips may go blue and they lose consciousness. With white breath-holding attacks, they're also known as reflex anoxic seizures. It usually occurs after a sudden fright or a sudden onset of pain, for example, a minor head injury. They will go pale, limp, and there will be loss of consciousness. Occasionally, they also look like they're having a seizure where their limbs will go very firm and there can be some shaking movements. What I'm going to do, I'm going to examine her, of course, now. What I'm going to do is I'm going to put you into my colleague who's essentially got a specialist interest in paediatrics. I'm going to get her to review and make sure that she's happy with the history as well. Does that make sense?
That's fine. I just want to check there's nothing long-term.
Absolutely, absolutely. No, of course. Pop her on your lap for me.
Go on. Get those at one lap.
Okay. And lift it up right up for me. Let's have a listen to her chest. Spin her around for me. Good, okay. So since the third, she's been back to her normal self, running around, playing active, no concerns?
Yeah.
Good, okay. Breath-holding attacks are not a sign of anything more sinister. However, occasionally they can be confused with epilepsy, which is why it's important to seek immediate medical attention if something like this occurs. If, of course, an episode recurs, you've done absolutely the right thing. I'm sure in A&E they showed you the basic things that you should do. So if it does recur, make sure you seek immediate medical attention. All right? Lovely. No trouble. All right, bye-bye now.
Your lights are on.
Thank you.
No worries. And that's good observancy.
Good observancy. Is observancy a word, though?
I don't know.
I bet you used to say millennium as well, didn't you?
Who?
Millennium for the millennium. Millennium.
Yeah. Can I help you?
OK, come in. Have a seat.
I've been given these tablets.
Yeah.
And these. And I'm also taking citalopram. But I haven't been given, they haven't been put on my repeat prescription.
Okay.
So I haven't taken them for a month.
Which one have you not taken?
Both all of them.
Right, OK. Whilst you're here, it would be an opportunity to just check if anything's changed since you were last seen.
No, nothing's really changed. It's just that I just don't like.
Because you used to take olanzapine.
Yeah,
now you're on this.
Yeah, I'm on that.
And do you think there's been any improvement?
There's been a little bit of improvement, but as I said, I haven't had them for about a month now.
Okay.
And everything, I'm getting all these thoughts back in my head.
Right. Robert suffers with schizophrenia, particularly psychosis. He suffers with symptoms of hearing voices, as well as symptoms of feeling quite low and depressed. This has developed during his 20s. He was someone who was functioning quite well. He held various jobs during his life, but unfortunately he went through difficulties. He wasn't able to function. So he started an antipsychotic medication. During the time he was on the medication, he became type 2 diabetic. OK, if you ever get into a situation where your medications aren't there, and, you know, they say there's no appointment, somehow or another we need to contact you even on that day so that at least we can sort it out. And usually we can see you even as an emergency or do it over the phone. And then with the diabetes side of things...
Last week, when I had a hypo, my blood sugar level was at 2.4, and I checked it 2 hours later, and it managed to get up to 2.6.
And were you taking these tablets at that time?
No, I wasn't taking them. No. Because that's what I said. I went out of them. I ain't had them for a month.
And yet your blood sugar was low?
Yeah.
Did you feel unwell last week?
Well, I felt really ill last week.
Have you been eating?
Yeah, I've been eating.
Yeah.
I had a big fat kebab and everything. So I was all right. The next day I woke up and it was just my blood sugar level was just as low as it was.
So we have seen in research that diabetes can be 2 to 3 times higher in prevalence in those with severe mental illness compared to the general population. Patients who suffer with severe mental illness are at risk of having poorer lifestyles. They tend to have poorer nutrition, partly because they have less income to try and afford healthier foods. And some of the antipsychotics can lead to a rise in blood sugars. So it is difficult for patients with severe mental illness. Do you drink alcohol at all?
Yeah, a little bit, but not a lot.
How much is it at the moment?
I drink 5 units a week, a day. Usually it's just 2 cans of beer that I have, and that's it.
What kind of beer is that?
It's a K-cider, which is 8.5% in volume.
Okay.
Sometimes I don't drink. I go days and days and days without drinking. Where I'll just drink. Where I'll just drink, literally just drink water.
Right. So you have some alcohol-free days.
Yeah, I have plenty of alcohol-free days.
Right. Good.
I only have a drink. I have a drink when I get paid, and that's it.
Okay.
Once every 2 weeks.
Okay. What we will do, you're going to see your consultant, and I'd like to see you shortly after that. And then, obviously, the reason you came today, I must give you a prescription. All right?
Thank you very much.
Okay, see you soon. Okay, take care.
My daughter had an appointment at 9:30. Can I cancel that, please?
Right, now I need somebody to tell me how to cancel this, because I don't know how to do it. How do we cancel it? This lady needs to cancel her daughter's appointment.
It's going to be the easiest thing you ever do.
What did you press?
C.
Why did you press C?
Cancel.
I will get there, sorry. OK, have a seat.
Thank you.
Just check your oxygen levels. That's it.
I'd rather not have a bad chest. But
Yeah.
You're the person to see when you put me at ease, totally at ease.
Oh,
you do.
good, good.
I mean, the last time I was feeling a bit rough, and I've come out of here feeling all right,
Oh, good.
It's when I inhale the cold.
Yes, yeah.
It seems to do me no good
It
at all.
affects your chest. You're feeling up to the breathing test
Yeah,
today?
yeah. Well, I dread it, but you know what I mean, don't you? Got to be done.
And you don't smoke anymore, do you,
No,
John?
No. 50 a day I used to smoke.
Gosh.
Silly, isn't it? God
Failed
gave
it.
me a pair of lungs. I could run cross country. I used to box when I was
Boxing.
in. What do? I smoke 50 a day and destroy it all.
Yeah.
Crazy,
But,
isn't it?
you know, when you were young, though, nobody knew the dangers of cigarettes,
I
did
watched
they?
all my favourite film stars smoking, so I
Mhm.
thought if they're doing it, it'd be okay, wouldn't it?
And in the army, they used to give out the cigarettes, didn't
200
they?
a week I
Yeah.
used to smoke.
The first test is the relaxed blow.
Right.
Okay, so so it's big breath in, fill your lungs as much as you
I'm
can,
just bracing myself now.
tube in mouth, pinch your nose,
Yeah.
and then just blow out nice and slow and steady. Okay, so fill your lungs. That's it. Tube in mouth, pinch your nose. That's good. Keep going, keep going, keep going, as much as you can. Squeeze it all out. Good, well done.
Was it good? I didn't think it was very good.
Well, we'll have a look at the results in the end. So the next one is the forced blow, where you blow out really hard and fast.
As long as I can, obviously.
Yeah. Okay, so it's big breath in, remember? So big breath in. Okay, really go for it, yeah?
Yeah.
That's good. Keep going, keep going, keep going, keep going, keep going, keep going, keep going. As much as you can. Good, well done.
Was it? I thought that was rubbish. I'm doing the best I can.
Got a nice shade of scarlet when you're doing it. So we measured how much you blow out in 1 second. That was pretty much exactly the same as last year.
Yeah. Okay, good.
Your full lung capacity is better.
Really?
You blew better this year than you did last
Oh, that's
year.
brilliant.
Last year you blew 2.96 litres. This year you blew 3.24 litres.
Brilliant.
So that's good.
When I leave here, I'm going to have a run around the block.
So you've done better than you did last year. So that's good. Okay.
Is that it?
That's it, I
That's
think.
wonderful.
Yeah. If you do have any problems with your chest, just come in and ask for an emergency doctor's appointment, yeah?
Can I just tell you a good joke? It's perfect.
Okay.
It's an Essex joke.
All right, go on then.
So there's a nightclub and there's a fight in this nightclub. And this blonde comes out covered in blood. The ambulance arrives and the paramedic said, "Where are you bleeding from?" She said, "Romford." Thank you very much.
Very
It's
good. Nice to
absolute
see you, John. Take care.
See you next year.
Yeah, take care. All the best. Bye-bye.
Yes, Dr. Hyder, come through and have a seat. And how are you?
Yeah, not very well.
Not very well. How can I help you today?
Last Tuesday, I had a phone call
from Maxim Hospital that I have got gestational diabetes. And since then I've been checking my blood sugar.
Yeah.
Which is, results are not very good. And I phoned them this morning and I left a message at 8 o'clock.
Okay.
Nobody rang me back.
Okay. And are you on any medication? Have they started you on metformin or any
No.
medication? No. Is it your first pregnancy? Okay. So they're usually a bit higher than desired, aren't they? Gestational diabetes is a type of diabetes you get in pregnancy. It's when the pancreas is not producing enough insulin for the body's demands, so you get high blood sugars. The main risk to the mother and baby is that you get macrosomia, which is when you have a baby that is much larger than an average size. And the risk to the mother is that that will then be very difficult to deliver that baby vaginally.
Like last night, I just had salad in my dinner.
Yeah.
And it was 5.2, which was normal.
Yeah.
So this morning, I don't know why did it shoot up.
Yeah. It's sometimes just related to having the problem, gestational diabetes, and not because of what you're eating necessarily, because the pancreas is not sufficiently working, which is why it's not lowering the sugars enough. Sometimes you need to start some medication in pregnancy for that as well, and it's usually metformin. But what we can do is try and call the nurse now so she can see you if she's answering. Yeah.
Thank you.
How many weeks pregnant are you at the moment?
30.
30. No, so it's the same again, answer machine. What I'll do is I'll speak to the obstetric doctors as well and just ask them if they want you to start on any medication. Hi, it's Dr. Hyder, GP calling. Could I speak to the on-call obstetric doctor for advice, please? Thank you.
Just take a seat there. Oh, sorry, is this Mum?
Thank you much. Oh, butterfingers.
Ow! Pinch yourself.
Yes.
Oh, bless you.
I'm not crying. Bye. Ow. Oh, bang me knee.
Right, how can I help?
Right, my problem is my toe. They sent me for X-ray.
Yeah.
It's come out as some arthritis. But after a whole day at work, I just find it very painful. It does hurt at night as well.
It's called hallux rigidus, is what it's called. And it's a stiffness of that joint. It can be made worse by wearing heels.
I don't wear heels.
You wear flats, yeah.
Because I work in the hospital, I'm always on flats as well.
And you're always on your feet.
Yeah.
Yeah. The only solution to this is an operation. The operation itself is painful, and it's very painful afterwards. But that recovery period lasts about 6 weeks or so, after which you're left with a stiff, surgically frozen joint here, but it's not painful anymore. But you have to be willing to have that surgery. It's not something I would jump into without sufficient thought. Unfortunately, the only other things that help are icing the joint. People underestimate greatly the amount of relief that you get from icing a joint because there's inflammation in there, and the ice slows that inflammation down.
Okay, is it because I'm lacking something? Or?
I suppose it's really a relic of evolution. All of our weight bears down on our feet, and in order to walk forward, you have to spring off your foot, and that joint takes most of the strain from the spring, and that's why it happens. It doesn't happen to everyone.
I've had bloods done recently.
Yes.
And my HbA1c was it?
HbA1c, yeah.
Has it gone up?
Yes, it has gone up. Are you taking any sugar? You're eating no sugar?
I'm eating biscuits and chocolate. I think that's what it was.
Biscuits have the three things in life we do not need: salt, sugar, and fat. I know they're hard to do.
I know at work, you're working all day long and then you want to treat them.
Have an apple. Have an orange.
I do apple and fruits. I love my apples.
Okay. Okay, so that's what you have, and I'd like you to read up on it on patient.co.uk.
Thank you. So just take the naproxen, do the ice treatment, like you recommended.
Correct.
Oh, thank you very much.
All the best. Yeah. Bye.
OK, that's great. Thanks for your help. Bye. Yep, so they're not too concerned about the readings at the moment. They think that the diabetic nurse will be able to give you advice when you've done a few more readings. They would probably start you on metformin if you had around 3 readings above 7 before meals, which you haven't had. Gestational diabetes tends to disappear after delivering the baby. However, there is an increased risk of developing type 2 diabetes later on in life. OK, all right, so see what they say, and if you're still not sure, then you can phone us and speak to us on the phone as well for advice. All right, take care then. Bye-bye.
Hello.
Hello.
Nice to see you.
Yeah.
So how are you?
Oh, I'm okay.
Good. You're looking well.
Yeah.
Yeah. What do you do during your days at the moment?
Today I went to Whitwell Day Centre.
And how often do you go there?
Every Wednesday.
Every Wednesday. And what do you do the rest of the week?
On a Monday, I go recycle teenagers.
You go and recycle teenagers?
Yeah.
That sounds fantastic. How do you recycle a teenager?
Drink a lot of tea.
You drink a lot of tea?
Yeah.
Brilliant. How would you describe your health?
A lot better.
OK. Can I ask how your water works? Because in the past you've had the occasional trouble with those, haven't you?
I do wee a lot, you know.
We went on a trip last Friday and he was going to the toilet a lot.
Yeah, how about night time?
About 4 or 5 and that.
You're getting up 4 or 5 times at night?
Yeah.
That's quite a lot, isn't it?
Yeah.
Would you mind if I examined your prostate? Do you know how I do that?
Yeah, OK. Was that when you put your hand...
Do an internal examination in the back passage?
Yeah.
That's right, yeah. Is that OK if I do that?
Yeah.
It would be useful for me today to do that. Is that OK? Yeah. Would you mind popping on the couch for me then, and we'll do that for you?
Do you want me to leave the room?
That's fine if you want to stay. Are you OK for wanting to stay?
Happy you be here.
OK, but we'll draw the curtain round.
Yes,
OK?
curtain. OK.
OK, do you want to lie on the couch? That's it. Swing your feet up. Bit of jelly. OK. OK. Right, that's it. We're done.
Is it done?
That's we're done. Yep. OK. That's it. Lovely. Do you want to get yourself dressed and then come out?
Yeah.
Is that OK? So you've got a tablet for your prostate and a tablet for your bladder to try and control that. So you're on the maximum treatment already, really.
Oh, OK.
You know,
But the prostate, you think, is just...
It felt completely OK examining you, just a
Yeah.
bit. I think the problem was as much with the bladder being sensitive as with the
Yeah,
prostate.
because sometimes,
Yeah.
I mean, I know last time that, I mean, he wants to go, but it's not a lot.
Yes.
When we're out, we drink more, don't we?
Yeah, I try and cut back
Yeah,
on
there's always that
how
wish,
much
isn't
we
there?
drink.
Because you're out. Yeah.
Cut back a bit, you know.
Yeah.
Well, thank you for coming.
OK.
It's nice to see you.
Thank you.
OK.
All right.
Thanks for coming. Nice to see you.
Nice to see
Take
you.
care. Bye-bye.
See ya.
You're going to be all right.
I'm going to be all right. I've survived this long. Why not carry on?
Lovely, thank you very much, Doctor.
Bye-bye.
Hello, Fun and Rose Surgery. Nikki speaking. How can I help?
My anxiety attacks are coming back.
Okay.
I went in Asda a couple of weeks back and I just had a meltdown.
Did you get an appointment through for your eyes?
I've got friendly eyes. They keep looking at each other across my nose. They actually cut me down the side here and then flat that under to make the new bottom to the mouth.
Because of the type of injury that you had, I will need to examine the back passage just to make sure that everything is working OK. Is that all right?
Not really, no.
Whereabouts is the abscess?
Please stop touching it, because that's very
Okay, I'm sorry.
You all right?
Yeah, it's fine. No worse than this.
Hiya. Can you see how many people are in front of me for Dr. Giovanni? Giordi?
Durangi. No one can say his name. There's one at the moment.
One before your 10 o'clock appointment, yeah?
Thanks. Sorry.
Matthew Thomas? Hello, it's Dr. Hyder. Come through and have a seat. I'm sorry you've been waiting. How can I help you today?
Okay, I've got this swelling on the side of my face.
Okay.
And I've got this pain going from my ear all the way down to my throat.
When did it start?
It started swelling up about a week ago, and then the pain's just got worse and worse and worse and worse.
Is your throat feeling sore?
Yeah.
Okay. Did it start with a sore throat or did it start with a swelling?
It started with the swelling.
Have you had your teeth checked at all recently?
Yeah, I've had my wisdom tooth taken out about a couple of months ago.
And was it on the same side as this?
Yeah.
So it's painful up here?
Yeah.
It's quite a large swelling, isn't it? So it was 2 months ago, the dental extraction. Was it at the top or the bottom?
It was on the bottom one, because I cracked it in half and they put a fill in.
It might be that there is an abscess at the base of that tooth that's causing the swelling and the pain. And you've got fever as well. So I think you definitely need some antibiotics, but I also think you should see the dentist today. I'll write you a little letter so you can get seen today as well.
Okay.
Because if they say it's not a dental problem, then we need to see you back after the antibiotics, especially if it's not fully resolved. Okay? And that's the prescription with the 2 antibiotics on there.
Well done.
All right,
Cheers,
take care. Bye-bye.
Do you cough much, Maureen?
I do, because I do smoke, I must admit, but
You're still
I only smoke
smoking?
about 15 a day. I'm getting down that way.
Oh, right. What did you used to smoke?
I smoked about 30 a day, maybe a bit more. It all depends how stressed out I was.
Carrying
Yes.
on reducing it down. Eventually want to stop altogether.
Yeah, I do, yes.
Good. That's good. Right. So do you feel up for the breathing test?
Well, that's going to be a hard one, isn't it?
So we have the relaxed blow first, Maureen. So it's big breath in, fill your lungs as much as you can, tube in mouth, pinch your nose, and then just blow out nice and slow and steady.
Deep breath, yeah?
Yeah, big breath first. That's good. Keep going, keep going, keep going. Squeeze it out. Good, well done. So that's the easy bit done. Now we've got the forced blow. Okay, so we need lots of effort with this one. So blow out as hard and as fast as you can. That's good, keep going. Keep going, keep going. Well done. It's your workout for the day. You're blowing sort of below on everything, really. People who carry a little bit of weight, they don't have the ability to blow out.
Yeah.
You know, they don't have a good lung capacity because of the restriction.
Yeah.
So what I'll do, I'll just give you one inhaler to start off with that you take every day. And that just helps to open up the airways, okay?
Yeah.
Mr. Kadira, please. Eureka Kadira. Hi, sir. Yeah, I think we spoke the other day on the phone.
Yeah.
So, how are things with the pain?
Pain I'm getting, especially in the back here.
Yeah.
And a bit up here.
Okay. Any numbness or weakness in your legs?
Yeah, there is weakness, not numbness.
Okay.
Like, that's as far as I can lift it.
But is that because of the pain?
Straight away.
Pain starts kicking in.
I've had a whack here. I was on a motorbike.
Right.
And I've hit a car at 50 mile an hour, I've been told. I was all unconscious. I don't remember 5 miles before it or anything.
Yeah.
I hit the car at 50. This has been held by the handlebars or the petrol tank.
Okay.
Do you know what I mean? I've been...
Okay.
I've had a whack here. I've even got a bruise on my cock.
Coccyx. Oh, you got
on your
okay. Yeah.
Yeah, I've even got a bruise there, which is quite a shock.
Yeah.
Where your thumb was, that was painful. And that, there, now. No, not there.
I had a really bad ear in the night, and when I woke up, there was blood on the pillow.
Has the pain improved?
I'm in agony.
I've had a couple of really nasty episodes recently.
Okay, from the point of view of pain?
It's got to the point where I thought I was going to pass out.
No, not there. No, no, no.
How would you describe this sort of sensation? Like electric shock?
Exactly.
I feel I can't go on any longer. The pain is there every day.
I had this myself, and it is very painful.
No.
I'm just feeling
Bit further.
I'm just feeling for the pulse.
Oh, yeah.
I hope you got one.
I hoped.
Can I ask you actually to remove the jeans then, and then I can examine you on the couch? And just to let you know, sir, because of the type of injury that you had and the fact you've had some numbness and weakness in the legs, I will need to examine the back passage just to make sure that everything is working okay. Is that all right?
Not really, no. It's nothing to do with that.
The only reason I say that is that sometimes the nerves in the spine can get damaged with this type of accident. So I just want to make sure that from that point of view things are fine. But if that's okay, if you don't want to be examined. Right. Just close your eyes for me. Just lean back, close your eyes, pop your arms by your sides. Just say yes when you can feel me tap, okay?
Okay. Yes. 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 Yes.
Okay, open your eyes again.
Yeah.
Just try and raise this leg up for me, nice and straight. Good. Good.
That one.
That's
hurts here.
Okay, that's fine. Okay, you can put your things back on.
It's not my legs I'm worried about, it's...
Yeah.
When that gets going, honestly, I'm like that, you know what I mean? It's so much pain I want to scream, but I can't scream because that would hurt.
So I think what we'll do is we'll give you some liquid morphine to start with. Obviously...
I can't inject myself, it's a...
Sorry?
It's an
No, it's a liquid, yeah. Absolutely. No.
I passed out the other day when they took 7 things of blood out of me.
No.
So we're giving some liquid morphine.
You ever seen anyone with 11 cracked ribs still walking?
No, in fairness, I expected you to
3
be...
days after the accident.
I expected you to be walking gingerly a lot more.
The police and the paramedics said they were amazed that I was, how I wasn't, you know... I mean, I was unconscious, fair enough, but...
Yeah.
I wasn't... I did come to, they said, at times, but I don't remember it.
So this is the oral morphine, okay? So you can take 2.5 mils every 4 to 6 hours.
Is that going to be enough?
That should be, yeah. So you can double it if you absolutely need to, so 2.5 to 5, but try and take the lower dose.
Thank you very much.
All right.
Cheers.
Take care.
Come in, young man, take a seat. Hi.
I saw you like a week ago.
Yeah, and I sent you up to A&E because you'd fallen over the desk. Is that when you broke your clavicle? Yeah. I did say I thought you had.
It's not this time.
It's not a broken clavicle, though, is it?
Yeah, it is.
I think it's a chip. You chipped his shoulder.
Oh, okay. A&E letter says broken clavicle, but I presume you've seen the fracture clinic since then.
And they said that it's a... So now I've...
Oh, no, you've fallen again?
Yeah, out of the bath.
So I can't walk on it. So
It's very tender.
yesterday it had a massive lump.
So tell me exactly what happened.
So you know I can't see peripheral lines.
Yeah.
It used to be that I could only see that. Now it's as if it's only that.
And you're quite good at turning your head.
Yeah.
So
Not
that
so much this side, but yeah. I can turn.
What's happening to Max is that the outside of his vision is going, so it's coming in slowly, developing what we call tunnel vision. And at some point, that will become a very small gap that he can see through. He's had a number of tests to try and work out why he's losing his vision. All of those have come back negative, so we're unfortunately in the position that he is losing his sight, but we have no idea why, how long it's going to take and what the end result is going to be. So you hit your knee on the door, you think?
Yes, just here.
Did it twist as you went down? Did you feel it twist?
I don't know, but I could hardly get up at that point.
OK, can you put your leg out straight for me?
Yeah, now it hurts there.
It hurts here?
Yeah.
I don't think you've done your ligaments. I think it's that this is so bruised here that when you try and put your weight through it, it wobbles because that ligament's not happy at the moment, but I don't think you've torn anything.
Okay.
OK?
So what should I do now then?
I sit 2 or 3 times a day for about 15 minutes at a time.
Let's get you home.
Nice to see you, Max. Just a shame that you're injured.
Okay.
Yeah, all right.
Thanks ever so much.
Take care. Bye,
Thank you.
Mel.
Bye-bye now.
Hello there, there's a problem on the parking out there. People can't get in and out.
Oh no.
Ridiculous.
It's a nightmare. When I leave here at night, I've got an estate and I have the parking sensors on going.
Yeah,
Yeah, nightmare.
it is.
Hello, how are you?
Yeah, not too bad,
Good,
you?
all right, thank you.
We've got an audience
Hello.
today. Hiya.
Why aren't you at school?
She's got a dodgy tongue.
Have
So
you?
we've got to see the doctor.
Sit here, lovey. Right, let's have a look. So, how's it looking? Because I've not seen it for a couple
Yeah,
of
it's been
weeks.
3 weeks, isn't it? Yeah, it's looking
Healing
quite
well,
good.
but my skin looks a bit red. Do you want to nip next door and just collect the stuff? Because there's nothing in
I've got the honey dressing with
You got
me.
the honey?
Yeah, but
oh,
it hasn't been
oh,
opened.
okay. That we need some scissors. Yeah. You haven't got any scissors in here,
Yeah,
have you?
scissors
Oh,
in there,
scissors
no.
are here. We're all set up.
That's my complete kit, that is.
Excellent, excellent. So we are sorted. Okay. Do you want to do the dressing, Kerry? This is Kerry.
Hello, Kerry. You get the joys of changing manky dressings today, do you?
There's no kit in here.
Yeah.
So all we do is spend our life going backwards and forwards.
Yeah. Don't you have like a trolley you can sort of bring everything in on?
Yeah, could do. If I was that organised and didn't get stuck in traffic this morning. It looks better.
Yeah.
Yeah. It's healing round the outside, isn't it? That's good.
What do you think, Mia? It looks better, doesn't it?
Do you think it's looking better?
My daughter thought I was pulling her leg when I said I was putting honey on it.
Really?
They all thought I was joking.
The honey dressings that we use are specially formulated and for medical purposes only. It has excellent antibacterial properties and is very good at cleaning or de-sloughing of the wounds.
Honey's for eating, right? Okay.
Lovely. Thank you very much.
You're welcome.
Right, she'll be back with your bits.
Yeah,
Okay,
lovely.
see
All right,
you.
cheers then.
Bye.
Ta-da.
Bye, lovey.
Here you go.
Sorted? Wow.
Yeah.
That'll keep me going.
All right.
Thank you very much.
I hope you feel better, little miss.
Yeah.
How old are you? 11.
11, going on 16.
Okay, so you're one of the older one in year 6. Aww.
Right, I'll see you Monday then.
Okay, take care.
Andrew, ta-da.
Bye.
Clifford Hudson?
Yeah.
Thanks for waiting. It's been a bit of a long wait for you, hasn't it? Come and have a
That's
seat.
all right. That's quite all right. It's
Have a seat down there. So this foot...
it's my foot that I'm complaining about. I don't know whether I pulled the ligament or what.
So what happened?
Well, it's been going on for about a month.
Okay.
But Friday was the worst. I started dragging my leg, dragging
Okay.
this leg, look.
Okay. Yeah, it's a bit swollen, isn't it? Have you ever had anything like this before?
No, never in my life.
All right, put your foot down for us.
Oh, yeah, you fit it.
Do you want to put your shoes back on? So what made you worry about it today?
Well, I thought I could get over it, like, you know.
That it just settle?
Yeah, let it settle, but apparently not.
I think you must have done something just to upset some of the soft tissue, maybe the ligaments or the muscles there, and it's caused the swelling. So I think, you know, you were right to sort of see if it settles, but perhaps you need a bit of medication to help it on its way. Do you ever get problems with constipation or anything like that? Like if I was to give you some cocodamol, for example?
No, because I went to buy some food and I thought, oh, I fancy a pasty.
Okay.
So I picked this pasty up.
Yeah.
I took it home, I put it in the microwave and had some chips.
Okay.
But that pasty upset my stomach
Okay.
and it was diarrhoea.
Is that all settled now?
Yeah, it's all settled now, yeah.
So what I'd like to do is I'd like to give you some medication for the pain.
Yeah.
But I also want to give you something for the swelling a little bit.
I see, yes.
It's a water tablet. The water tablet
Yes.
will help to reduce some of that swelling, which I think is causing pressure on your foot.
I see,
Okay.
yes.
One of the side effects is it will make you want to pee a bit more.
Oh, I see, right, yes.
So you might have to put up with that a little bit, but only
Yes.
for the first week.
I mean, because I'm 80 years of age now and, you know, my daughter aggravates me, look after yourself, you know, and what you're playing at and all that sort of caper.
Yeah.
But I'm due to go to Butlins.
Okay.
For a break.
Well, hopefully by then this will be better. with
Well,
a
I
bit
hope so. You know, I'm hoping by heaven, you know, because you're never getting any younger, you know, you're getting older and older all the time. So, anyway,
right.
thanks for this, and
No
I'll
problem.
go and get this and see how I go.
Take care, all right.
Thank you very much, thank you.
Nice to see you.
Yeah, so
Bye-bye.
see you, bye.
See ya.
Gary Bourne, please. Sorry about the weird, Gary. So how's things with you?
I'm meant to be going in to have the skin taken off inside the mouth to get rid of hair follicles
That's right,
because
yeah.
they flap the skin from the outside in and the hair grows inside the mouth now. And also had the bone retrimmed
Yes. Yeah.
because they took the bone out of the leg, the fibula bone, to reconstruct the jaw,
Yeah.
which was removed through the tumour, and it's failed.
So you've got a little bit of bone that sticks
Yeah.
out, haven't you? So what is, are they
They're gonna
planning to
try and
close
shave all that back,
up and
close it up, but put synthetic piece of bone in.
Oh, right.
Is it painful at all?
No, it feels like someone's stuffing a load of little needles in there.
So that's maybe like nerve endings coming back to life then, is it
Mhm.
really, you think? Is that how it feels, like a
Yeah.
nervy, tingly type pain? Looks like a nice clean dressing. Did you just put this on this morning?
Yeah, I had a shave this morning,
Oh, you
so
did?
I put new dressing on.
There's still a little bit of a smell coming
Yeah.
from it, isn't there? That bit there's bone. Okay. So was it just that the bone grew further after the surgery,
Yeah.
and that's why it started to
It
stick out?
overgranulated.
Yeah. So it just grew more than
Mm.
what it should have done.
They actually cut me down the side here. There's a faint scar you can see.
Yeah.
And then flap that under to make the new bottom to the mouth. So, because it was the outside, it's now inside. I'll grow a beard inside the mouth.
Hair inside his mouth.
But the only way you can get rid of it is with tweezers.
So you have to pluck inside your mouth.
Yeah.
But that hurts, does it?
It makes it bleed at times,
Yeah.
but it's not too bad.
Okay.
Okay, thanks a lot.
Ring up later on in the week or next week for an appointment, and
Right.
we'll see you again.
Thanks
Take
a lot for
care,
that.
Gary. Bye-bye.
Cheers, bye.
When I arrived, there was no parking, and I put it in the staff parking.
Okay.
But a car is parking in a red Citroen, and I'm not sure if it's staff.
Well, that's mine.
Oh, is it?
Yeah.
Oh, so sorry.
Okay, I'll have to move.
I did try to leave
Yeah.
you out. Sorry, I know I've put you out now. It's like a new car.
My one?
Yeah.
Mine's beautiful.
What am I doing for you?
Right, two things. My sick note's running out.
Mm-hmm. Why do you have that?
Because I was a heroin and crack addict. So I was in rehab, and I've come out of rehab now.
Okay.
And my sick note's run out because I had to change my doctors from Folkestone to here.
Okay.
And the job centre wants a new.
Have the job centre not done an assessment on you yet?
No, I'm on the SA.
On the
ESA,
I bet you they'll call you soon. We do a lot of substance misuse.
Yeah.
And just about every person that we've got as a patient, either here or in our clinics that we run, have been called up.
Right. Yeah, I don't know.
Because they won't accept that anymore as a sickness. So be prepared.
Yeah.
Okay.
Yeah.
So I'm just warning you because they will get around to you at some stage.
It's all new to me because I've been in and out of jail for 13 years now, and I've only changed your life.
Yeah.
So, and I'm doing well now.
Good.
So my next step is in the next 6 months is come off it all because I'm on Tex, 8 milligram Tex.
Subutex is a type of opiate analgesia similar to things like morphine or codeine, which we are using now to try and treat people who have heroin addictions. We use both Subutex and methadone. However, if somebody uses heroin on top of methadone, then they will get more of a high. Whereas if they have a reasonable dose of Subutex on board, they can take as much heroin as they like and it will give them no effect whatsoever. As such, we think it's a far better drug to use in the treatment of addiction.
I want to come off everything so I can go back to work. But I can't work while I'm on this.
You're not using on top?
No.
Well, see, a lot of people do, though.
Yeah, I know.
That's the problem.
I was at first, but not no more. But I'm on a decent life now. It's around enough of it all. Keep going in and out of prison and that, so yeah.
Do you suffer with anxiety problems?
Yes.
Yeah.
Yes. I feel like a hole appear in my chest, and I'll physically feel it.
A lot of the time it is a psychological trigger. Things that maybe you haven't dealt with that you think are underlying these palpitations.
I saw you because you were feeling very low.
Yeah, I'm getting worse, I think.
I'm getting worse.
I suffer with severe depression.
Okay.
Anxiety.
Yeah.
Insomnia.
That's the kind of main primary reason for you not feeling able to work.
The other thing is my anxiety attacks are coming back.
Okay, and when did they...
I've been getting them for years now, haven't I? It's probably scaring me.
Okay, and tell me what happens when they come along.
Well, I'll just go all hot and cold, sweats and that, and I'll just start panicking and that, and it's really bad panic and all, like, I can't breathe hardly.
And when do they tend to come?
When I'm stressed about something, or I'm out, like, around people, or I'm out shopping or whatever, it gets bad.
Okay.
I went in Asda a couple of weeks back, and I just had a meltdown. And I had to get out of there, drop everything, and get out of there so quick. It was unreal.
Anxiety is very common amongst ex-prisoners for two reasons. Firstly, if they have been in jail for some time, they're used to being looked after completely. And coming out into the world and having to fend for themselves will be a real problem for them. They could be anxious also because they're going into an environment which they previously knew, which was never good for them. And they're justifiably anxious or worried that the same thing may happen all over again. So at the moment, you're on your Subutex, and that's the only thing you're on at the moment, is that right?
Yeah, that's it, that's it. I don't take anything
And when were you last in... You said you've come out of rehab, so when were you in rehab?
I was in there, so I come out of there 4 or 5 months ago now.
Did you last for the entire program, or did you go out early?
No.
How long were you in for?
4.5 months.
Okay.
So, yeah, I've got... Because they try and make you mix in with all the others, and all the others were using in there.
Using in the rehab?
Yeah, in there.
It's an open rehab.
It's an open one.
Okay.
So, yeah, it was a nightmare.
Bad habit for it.
And I had to slip up in there. Since I've been out of there, I've been getting better, isn't it?
I'm going to change that thing and put chronic anxiety on there as well, actually, because I think that's probably of more significance than your substance misuse, to be fair. Do you know what I mean?
I know. I've abused my body.
OK, so you're aware that, of course, we don't want to give you things that are diazepam-related because of the effects like that. I also want to avoid things that are, that are saleable on the street, OK? Because at the moment there's a huge amount of stuff like pregabalin and gabapentin, which is being sold on the street. So what I want to do is give you actually something which is going to control some of those symptoms rather than be an absolute thing for it. But I also want to refer you to the talking therapies service, OK? Because I think that's important, OK? And using this sort of service is really beneficial for somebody, OK? That's your note.
Right, thank you very much.
I want you to try these.
Yep.
These are 1-3 times a day.
Right,
okay?
okay.
They're a beta blocker. They're designed to try and reduce heart rate. They try to stop sweating. They try and reduce tremor. Okay? And if you can keep those under control, then hopefully you don't escalate those anxiety-type symptoms.
I'm just glad I'm sorting my life out now, because I had 13 years of hell. It's been a nightmare. It took me all this time to sort it.
How old are you now, Christopher?
34.
34. You need to do something now, don't you?
Yeah. So I would end up otherwise probably 6 foot under otherwise.
Hamid Musa.
All right.
How are you?
Remember me?
I recognise you, yeah, you've been here before. This is the third lot of injections today. So we have 3 injections. Hello. Hello, how are you today? Oh.
Yes, happy before vaccination.
Yeah, happy before. OK, so we've got the meningitis B again. The other one is the pneumococcal one for pneumonia. And the last one is the one that's got the 5 things in, so the tetanus, polio, whooping cough, diphtheria and hips, all in one. So who's going to hold him?
Me.
You're going to be the brave one. You ready, baby? I'm sorry. One more in that leg. You hold him really still. Sorry. And then let's turn him over. Good boy, good boy. Okay, just hold him really tight. All done. There you go. All done.
Big tears.
Sure. You can have a sticker for your brother. What one would you like? I'll give you one of those. Because you was brave watching. There you go.
Thank you.
Why are you putting places at David, Mandy? Because I was rubbing his back and she wants to come and do it, and I've told her she can't. It's mine today. She's not allowed him.
Oh dear.
Say no more. Mandy's hiding out there. She will be hiding out there.
Well, you've embarrassed the poor girl, haven't you?
Have you gone all red again?
You have embarrassed her.
She's gone all red again.
Let them have their fun, Mandy. Don't you worry about it.
Hello, I'm Dr. Bolger. Nice to meet you. I have another GP sitting with me today. He's doing some training. Is that all right?
Far away.
Come on in and have a seat.
I think I got double teamed last time I was here with the nurses.
Come and have a seat. This is Dr. Siddiqui.
I began to think they might have to hold me down to take the blood.
But they've done it. They've done it. And Dr. Taylor put you on some metformin for your diabetes?
Yeah, he told me one a day to start with and then take it up, but
And where are you at now with that?
still on one a day.
Blood test looks great. It's dropped right back down, OK? So I'm assuming that you got to grips with your diet and eating and all that sort of stuff.
It's not rocket science.
It's not, no, but sometimes people get into a muddle about it. Yeah. The thing is that at any point you can change your mind about that. So if at some point you think, you know, I would like to pick a dietitian's brains, let us know. The other thing that she did at that appointment, I think, was to send you off to get your eyes checked. Did you get an appointment through for that?
Yeah, I have got to go and do the eye test one, as you can see. I've got friendly eyes. They keep looking at each other across my nose.
The eyes are important, yeah?
Yes, I know.
Because with this diagnosis, we don't want there to be anything going on at the back of your eyes that they're not aware of, yeah? So we did some more blood tests for you, and the only thing that we picked up is that your cholesterol is too high.
Yeah, it's
and
through
it's
the flipping
always been high, hasn't it, yeah?
sea.
Have you ever been on any tablets for it?
No.
How do you feel about tablets for cholesterol?
I don't like tablets.
No, I can understand that.
I never took them for headaches or anything.
Mm-hmm.
And now I've got to take the damn things all the time. Hence, it's a bit of a struggle just to remember to do it and things like that.
Cholesterol's all about risk. As we all get older, a high cholesterol is more likely to cause you trouble. And the trouble is that the ante's just been really upped by you being diagnosed as diabetic. Because diabetes is bad for your blood vessels, cholesterol is bad for your blood vessels. Your blood vessels aren't as good now as they were previously because, you know, we're all adding on years that we can't do anything about. You know where I'm going with this, don't you? How would you feel about trying something for your cholesterol?
I'll think about that.
Obviously, if you want to see how things go, we will keep on checking your cholesterol. But I'd have to say that if you were going to ask me for my advice, I would have thought that just being diagnosed as a diabetic was the time to do something about the cholesterol. What do you think? Or do you want to put that on hold for a little while?
Put that on hold if you don't mind for a little while.
Yeah, but you will think about it seriously for me, yeah?
Yep.
OK, I'll leave that one with you, yeah?
Yep.
Right, so can you remind me?
Yeah,
It was on the elbow, wasn't it?
yeah, on there, yeah.
It was leaning on it that was causing problems, wasn't it?
It was still stinging, so... But,
So when I saw you, I thought maybe it's, like we talked about lipomas for small fat lumps.
Yeah.
Well, the other thing is it's really small, and even though it's quite firm, when it's that small, it could be a little cyst. But the third possibility is something called a dermatofibroma, which is a type of skin lesion just underneath the surface of the skin. Yeah. Especially with things like dermatofibromas, they can come back. So it depends on whether, if it's a cyst, whether we get the whole capsule out, if it's a dermatofibroma, that we get the full edges. So there's a chance that it can recur.
I feel confident in you.
Good, I'm glad.
I think you'll be quite thorough.
Well, we'll find out, I guess.
Yeah.
OK, fantastic. Yeah, so this is the thing with this kind of thing, isn't it? We're going to have to get to the back of your elbow.
Right.
I'm going to bring the bed up anyway.
And then just put your arm on like that. Yeah, so the line's going to be going that way.
I can always have my first tattoo to cover it.
Yeah. So you're going to feel a sharp scratch coming out. You all right?
Yeah, it's fine. Yeah, I've had worse than this.
OK. Right, this might feel just a bit cold, OK? So just check first. Can't feel any of that?
No.
Good. How are you doing with this?
Yeah, fine. How's it looking?
Yeah, it's looking all right. Yeah, good. Underneath it.
It's a part of me I'll never see again.
No, definitely. Be a bit lighter now.
Yeah.
So are you feeling that?
No, it's fine.
All right, so completely dry for the next 2 days. In 2 days' time, you can take the dressing and the tape off, and you can leave it just open and exposed to air, OK? And I think the stitch is out in about anywhere between 10 to 14 days, depending on what they've got available.
Lovely.
All right, good. Take care, OK?
See you later. Bye.
Bye-bye.
Mandy, she wants you to take something to David.
Oh, no, I can't. Oh, I can't do it.
He's sitting in the tree. K-I-S-I-N-G.
That's bad. That's really bad.
Karina? Lily White? Hello. Have a seat. How can I help?
Basically, I've got an abscess on my leg.
Okay.
It will not go.
When did it first come on?
It's been ongoing for nearly enough 3 years.
3 years?
So I went to the hospital. I'm just waiting for an appointment now.
Okay. Whereabouts is the abscess?
Here.
Right.
Here.
So there's more than one?
Yeah.
Okay.
I've got some on the top of my privates as well.
Right. If you're okay with me having a look at them with a chaperone in, we'll have a look. Is that all right?
Yeah, it's fine.
Okay, that's fine.
Obviously, I'll have to take my dress.
Yeah, I'll see if I can grab a nurse who can come in as well.
Oh, why is the doctor?
Thank you. Right, this is my colleague Kerry.
Hiya.
So you're in a lot of pain. Shall we turn him so he can see you? At least see your face. Yeah. Right, so if you come behind there.
I'm not going to be able to get on this table.
Okay. Tell us when you're ready and we'll come round.
Yeah, fine.
Yeah? Let's have a look.
Sorry.
Right. Let's have a... Ooh. It's very tender.
Please stop touching it because that's very
Okay,
painful.
I'm sorry. It has started leaking.
Leanne, Leanne. Hello.
Yeah, sorry, you made me jump then.
I'm sorry. You're miles away doing something, weren't you?
I know.
Grossing your phone or...
Yeah, unfortunately. Oh, it's terrible. You're always constantly on them, aren't you?
Look what has happened to me in the last few months. I've become a great grandmother.
Oh, that's lovely.
That's a picture of my head.
Oh, wow. Looking quite red.
Do you want to have a good view of this? Are you going to be okay there, or is the phone more interesting?
That's probably the phone's more interesting, but
Probably with the rest of your life as well.
yeah.
I call you back, okay?
I'm just going to chat to Dr. Morris very quickly. All right.
Hi.
Hi, Chris. Right, so I have a young lady with me who has hidradenitis suppurativa. In her notes, you can see she's been seen multiple times. She's had loads of antibiotics. Personally, I think she would need to go into hospital to have it drained.
So you said it's not acute, but you said she might need to go into hospital
I think
to
she
get it
may
drained.
need, yeah.
From what you've told me, I would be inclined to go for the admission. As the admission.
Will do.
Is that okay?
Thank you very much, yeah.
Well done. Thank you for your help this morning.
No worries. Hello, young man. You happy now that you can see Mum again?
Yeah, he is.
Right, so I've had a chat with Dr. Morris. The option I think we may need to take in this case is for you to be seen in the hospital.
Well, if I have to, I'm going to have to.
Okay, fine. So I'm going to give them a call, and then I'll give you a letter. All right?
Will they give me any pain relief for this?
They will do, yeah, they will do. Hi, it's Dr. Siddiqui, GP registrar at Farnham Road. I've got a lady with an abscess in her right groin. I think it needs to be drained off. Okay, I'll send her with a letter for surgical on-call expected. Bye-bye. Right, so with regards to painkillers, I noticed you asked Dr. Taylor about them as well.
Yeah,
but he wasn't keen to give them to you. What the colleagues are concerned about is that there's too much cocodamol being dispensed here.
Yeah.
So this is the
so what do I
surgical
do in the
team.
meantime, obviously, because I'm in literally agony.
No, you have to go now to the hospital. So they
Yeah,
will
that's
give you
what I'm on
painkillers
about.
when you arrive.
Great, so if I go there, so it's a waste of time coming here then. So it's wasting more money coming here.
I don't mean it to be a waste of time, but
Well, it is really, for me, because obviously now I've got to go all the way to the hospital, waste more money getting up the hospital for them to not do nothing like they done last time.
we don't know that they're not going to do anything.
Well, I do, because I've been up there many of times with it. This
I'm
is
sorry
what
you feel that way,
saying.
but that's...
Obviously, they're useless. That hospital's literally completely useless. I'm going to have to ring in, obviously. I can't take the baby up there.
No. Let me just write your letter.
Hello, where are you? Well, you need to meet me at Wrexham Hospital. Well, because I've got to have this abscess drained. Well, you'll have to hurry up because you're going to have to sit there and watch Albie. I can't watch Albie and have that done at the same time, can I? Well, can you hurry up, please? Because I've got to go up there now. All right, love you, bye.
Just right here. All right. All right, Karina. So take that with you. Hopefully you'll get better soon.
Well, hopefully it ain't a waste of time again going up here. Because this is what end up happening. I end up getting back in the GP again. They're useless.
Hopefully they can do something. Take care.
Thanks.
Bye-bye.
Danielle Tour, please. Can I take some of these things from you?
Yeah, just that.
Oh, that suits me, do you think? Yes? Okay, why don't you come and have a sit up here?
Yeah.
And in the meantime, we'll get Mum to move your other little one over onto here.
Do you want me to...
Strip it down to the nappy. Please leave the nappy on. Let's have a little look. Oh, you're already doing one of the tests already. That's great. Hold on. Let's do that while we're there. And look at that head control, pulling that up. That's very good. Let's have a quick look in your eyes while we're... Shall we have a listen? Very good. I think she's great.
Yeah, she good?
Yeah, she's good. Now, what about you? How are you?
Yeah, I'm good. I've just had high blood pressure. You want to stand for a sec?
I want to do it.
Oh, here we go.
I always want to do it every day.
Are you gonna? Do you want to press the button? Okay, you ready? Press that button there. Good. That's brilliant. Danielle suffered from gestational hypertension, which is the development of high blood pressure after 20 weeks of pregnancy. This is very common, and 15% of pregnancies will go on to have high blood pressure. And in fact, it is the leading cause of people being admitted antenatally in this country. Most people with gestational hypertension will recover after they deliver their baby. And as GPs, we will monitor that process to make sure that this happens. A small proportion, however, will continue to have problems with their blood pressure and may need treatment for long into the future. How much did it go up to before?
And the bottom was 110.
Really?
Yeah.
Bottom was 110.
That's really good. I'm like, wow.
OK, so I suppose the problem is if we take you off your medication,
Yeah.
it may go soaring up again at the moment.
Okay.
Because what I would like it to do is start dropping down lower than that.
Like in the 70s.
Yeah, so and this top level coming down to in the just over the hundreds, and then
It's bizarre because I've never had this ever.
Amazing, isn't it? Yeah.
I mean, it was slightly high with her, but
Yeah.
in general, post-baby and everything,
Yeah.
nothing. I was
Amazing,
quite
isn't it?
surprised, and it's
Yeah.
been, I mean, I nearly ended up in hospital when I was like, oh, I can't be doing that.
Yeah, absolutely.
So
So it's doing the trick. I mean, that's
Yeah.
that's an okay, But my worry is that if it goes up, so I'm going to give you another 4-week supply of the medication.
Okay, 4 weeks, okay.
Okay.
Lovely, thank you.
You're welcome.
All right, so thanks.
Bye bye.
Okay, thank you, doctor.
See you later. Bye bye, everybody. Bye.
You take care.
Thank you.
Bye-bye. Goodbye.
Should we say bye as friends then?
Bye-bye.
No, I don't think so. Maybe next time.